Stand up right now. Go ahead. I'll wait. Now pay attention to what just occurred inside your body. Did you sense a slight stiffness in your joints? Perhaps a minor ache or tightness in your lower back? Or that usual impulse to sit down right away because standing begins to feel uneasy after only a few moments? That exact same quiet but real strain is taking place every single day, deep within your arteries. And it is much more serious and threatening than the majority of people ever fully grasp or acknowledge. The American Heart Association reports that close to half of all adults in America, roughly 122 million individuals, are dealing with high blood pressure. And here is the truly alarming and eye-opening fact. 75% of those affected are relying on prescribed drugs to keep it under control. Despite that, more than 675,000 Americans lose their lives each year to complications directly tied to high blood pressure, even though they follow their medication schedule every single day without fail. I'm Dr. Michael Kent, and having spent more than 20 years as a cardiac surgeon, performing open heart procedures and seeing the internal condition of human arteries up close during countless operations, I can clearly explain exactly why those medications so often fall short of delivering a true, lasting solution. The information most individuals receive about high blood pressure is seriously incomplete and built on old, outdated concepts that have not kept pace with current knowledge of vascular biology and disease progression. You have probably heard that high blood pressure is simply an issue of excessive pressure inside the pipes, like a plumbing system overloaded with too much water volume. Reduce salt intake, add a diuretic pill, bring the pressure down, and the problem is handled, correct? That explanation stems from medical ideas that date back 50 years and no longer reflect the full picture or the real underlying problem. The truth is far more involved and goes much deeper than just fluid amount or surface level pressure readings. High blood pressure is not mainly about extra fluid pushing against the walls. It is about the actual state and condition of the pipes themselves. Your arteries become injured, lose their natural flexibility, and break down at the microscopic and cellular level year after year. Drugs can temporarily bring down the figures you see on your blood pressure device, but they cannot heal or reverse that internal structural harm occurring inside the arterial walls themselves. During bypass surgeries, when I open the chest cavity, the difference becomes immediately obvious to the naked eye. Healthy arteries respond with elasticity when touched or incised. They spring back like rubber. Arteries affected by long-term high blood pressure feel hard and unyielding like bone when cut, brittle, loaded with calcium deposits, hardened and rigid. And that hardness and loss of flexibility, that is what high blood pressure truly represents at its deepest level. The medications may adjust the measurement you see for a period, but they leave the fundamental stiffness and cell-level deterioration in the artery walls completely unaddressed. That is precisely why so many individuals remain on medication for decades on end, yet their risk of heart attack, stroke, kidney failure, and other life-threatening complications stays elevated, even when the readings appear acceptable or controlled on paper. By the conclusion of this video, you will fully grasp the 4 concealed processes that cause and continue to sustain high blood pressure, along with the complete 4-step method to restore and repair your arteries at the structural and cellular level. This approach is rooted in cellular biology and biochemistry that you can begin applying right away to start reversing the damage that has accumulated silently for many years. Before we move forward, please leave a comment with your age. I want to know who is ready right now to take real control of their artery and heart health and make meaningful changes. Let me describe in clear, straightforward terms what is truly taking place in your body that almost no one explains properly. As you reach your 60s or 70s, your arteries go through 4 major shifts that directly affect blood pressure and the overall condition of your cardiovascular system. These shifts develop slowly and without obvious symptoms, over many years, but they establish the ideal environment for elevated blood pressure that worsens steadily unless the core issues are tackled properly. The first process is the breakdown of the glycocalyx and injury to the endothelium. Imagine your arteries as smooth, non-stick channels designed for easy blood movement without any friction or resistance. The innermost surface, known as the endothelium, is a single layer of cells thinner than a sheet of paper. It is covered by a tiny protective film called the glycocalyx, similar to a non-stick coating inside a cooking pan. This film enables effortless blood flow, triggers nitric oxide release to keep vessels open and relaxed, and stops inflammatory particles from attaching to the artery lining and causing internal damage. The trouble begins when long-term elevated blood sugar, ongoing low-level inflammation, previous or current smoking, and oxidative damage from free radicals gradually erode and destroy the glycocalyx layer. Once that protective film is lost or severely compromised, the vessels become rigid, inflammatory particles cling more readily, LDL cholesterol infiltrates the wall, and plaque starts to develop inside the artery. Here is the key. Fact most individuals never learn. No hypertension drug rebuilds or repairs the glycocalyx. ACE inhibitors, beta blockers, diuretics, calcium channel blockers, they adjust the reading on your device but leave this vital shield unrepaired and unprotected. That explains why people can show managed blood pressure on drugs, yet continue developing heart disease, strokes, or kidney failure over time. The glycocalyx harm persists quietly, and the drugs address only the outward symptom, elevated pressure, not the core problem, loss of protective lining and increased vulnerability. The second process is arterial hardening and calcium buildup. Most doctors concentrate only on blood pressure figures, ignoring whether the arteries remain flexible or have become rigid. Arteries should stretch and recoil like elastic bands with each heartbeat, cushioning pressure and aiding smooth circulation throughout the body. Long-term high blood pressure, diabetes, persistent inflammation, and aging harm the tunica media, the central layer responsible for that elasticity. Calcium accumulates within the wall, elastic fibers deteriorate and break apart, and smooth muscle cells change into bone-like structures, encouraging further calcification and hardening. This hardening is quantified by pulse wave velocity. Healthy arteries conduct the wave at 6 to 7 meters per second. Rigid arteries push it at 12 to 15 meters per second or higher. Faster waves signal greater cardiovascular danger because the heart must pump harder against unyielding tubes. No medication removes those calcium deposits or restores lost flexibility. However, targeted nutrition and lifestyle measures aimed at the cell level can partially reverse some calcification and decrease rigidity over months and years of steady, consistent effort. The third process is insufficient nitric oxide. Nitric oxide is a gas molecule generated by endothelial cells that maintains vessel openness. Created through the ENOS enzyme, it instructs smooth muscle to expand, decreasing resistance and supporting normal blood pressure. Damage to the glycocalyx impairs ENOS activity. When ENOS loses its balance due to oxidative stress or lack of BH4 cofactor, it generates damaging free radicals rather than helpful nitric oxide. Without adequate nitric oxide, vessels remain constricted, resistance climbs sharply, and blood pressure rises. Studies demonstrate that isometric hand grip exercises, gripping at 30% of maximum strength for 2 minutes, resting 1 minute, repeating 4 times, stimulate ENOS and elevate nitric oxide naturally. Switching to nasal breathing instead of mouth breathing boosts nitric oxide by up to 400% due to sinus release during inhalation. When nitric oxide drops consistently, arteries stay constricted and no drug fully recreates this natural dilation system the body is built to use every day. The fourth process involves the insulin-kidney link. Many do not realize sodium limitation fails for numerous people because of persistently high insulin. Chronic elevated insulin forces the kidneys to retain sodium regardless of dietary intake. Insulin promotes sodium reabsorption, activates the sympathetic nervous system stress response, and heightens sensitivity to angiotensin II, a strong vessel constrictor. This explains why insulin-resistant individuals, even without diabetes, frequently develop hypertension that resists treatment. Fasting blood sugar and A1C may appear normal, but ongoing high insulin silently causes sodium retention and sustains high blood pressure. This process accounts for why many older adults have difficult to manage hypertension despite low-salt diets and multiple drugs. The insulin issue keeps kidneys retaining sodium and fluid, maintaining pressure elevation. Consider two real-life examples to make these processes clear. John, age 71, dealt with hypertension for 13 years on 2 medications. Readings averaged 130/82, but tests revealed endothelial dysfunction and low nitric oxide markers. He experienced constant anxiety, tiredness, and frustration. We began the vascular repair protocol, controlled blood sugar with eating window restrictions and carb reduction, added fucoidan 800 mg daily for Glycocalyx support, and boosted polyphenol intake from berries, leafy greens, beets, and dark chocolate. After 12 weeks, endothelial dilation rose from 5% to 13%, blood pressure fell to 116/74 without extra drugs, and he regained energy, confidence, and daily independence. The glycocalyx started healing. Nitric oxide increased, outcomes drugs alone could not produce. Martha, age 74, had hypertension for 18 years, used 4 medications, and showed severe arterial calcification on CT scan. Vessels appeared stiff and bone-like. She felt fearful, drained, and skeptical about improvement. We focused on decalcification, vitamin K2, MK7, 360 mcg daily to activate matrix GALA protein, vitamin D 6000 IU daily for proper calcium direction, and magnesium glycinate 600 mg daily for balance. After 6 months, her calcium score dropped 9%, blood pressure reached 122/78, and she reduced to 3 medications under supervision. After 18 months, she was on 1 medication with strong control, and CT showed 16% calcification reduction. These cases prove how repairing structural vascular damage, targeting glycocalyx injury, calcification, nitric oxide shortage, and insulin-driven sodium retention can transform health when root causes are addressed instead of just symptom control with more drugs. Now let me teach you the vascular protocol, a 4-step method targeting these processes directly. Step 4. Glycocalyx restoration. Keep post-meal blood sugar under 140 mg DL through eating window control and carb management. Supply repair materials with fucoidan 600 to 1000 mg daily, a seaweed compound supporting glycocalyx rebuilding, and lower oxidative stress using polyphenol-rich foods like berries, leafy greens, beets, dark chocolate, and green tea. This step rebuilds the protective film, enhances circulation, decreases inflammation, and helps stop plaque. Step 3. Decalcification. Activate matrix GALA protein with vitamin K2, MK7, 180/360 mcg daily to stop calcium artery deposits, support correct calcium placement in bones with vitamin D, 6000 IU daily, and add magnesium glycinate, 600 mg daily to manage calcium and relax vessels. This step gradually softens rigid arteries and reduces calcification. Step 2. Nitric oxide restoration. Protect ENOS cofactor BH4 with folate 400/800 mcg, vitamin C 1000 and 2000 mg, and vitamin E mixed tocopherols. Stimulate ENOS through isometric hand grip training, 30% max strength, 2-minute hold, 1-minute rest, 4 repetitions 4 times weekly, and practice nasal breathing to raise nitric oxide up to 400% over mouth breathing. This step naturally relaxes vessels and lowers resistance. Step 1. Insulin reset. Lower insulin with time-restricted eating, 16.8 fasting, eating window, noon 8 p.m. as a good start, and resistance training 2 to 3 times weekly to boost muscle insulin receptor sensitivity. Step 1 is most powerful because it frees kidneys to balance sodium and pressure, tackling many resistant hypertension cases. Here is what you can realistically expect when following the protocol. In week 1, subtle changes may appear: reduced morning stiffness, slight pressure drop, and a small energy boost. By week 2, systolic pressure often drops noticeably. Many experience 8 to 15 point reduction, and energy and mood lift noticeably. Weeks 3 to 4 show measurable vascular improvements, increased nitric oxide, and early calcification reversal on follow-up tests for some. Beyond week 4, structural changes emerge: decreased arterial rigidity, lower cardiovascular risk markers, better endothelial function, and possible gradual medication reduction under doctor guidance. This is not simple symptom relief. It is structural vascular transformation addressing root causes at the cellular level. Let me be very clear. This protocol is not a hypertension cure and is not a substitute for medical care. Never stop prescribed medications without clear physician approval. Those with kidney disease, heart disease, or diabetes must follow these steps under close medical oversight to prevent complications. Start slowly. Choose one step initially. Track blood pressure daily, morning and evening, and note how you feel. Add further steps gradually as your body adjusts safely. Always collaborate with your doctor to understand changes and modify appropriately. Here is my challenge. Select one element of the vascular protocol, perhaps post-meal blood sugar control, vitamin K2 supplementation, hand grip exercises, or time-restricted eating, and stick to it consistently for 30 days. Track results carefully. Blood pressure numbers, energy levels, mood, stiffness changes, then return and leave a comment sharing what occurred. Your arteries have carried you through decades. They deserve repair and attention. If this information was helpful, subscribe so you don't miss future videos. Next week, I will discuss the single most overlooked nutrient for cardiovascular reversal, and one tip will surprise even experienced physicians. Stand up for a moment. Did you notice any stiffness in your knees or back? That same silent stress is occurring inside your arteries right now, and it is far more serious than most understand. The American Heart Association states nearly half of American adults, around 122 million people, have high blood pressure. Here is the shocking part. 75% are on medication to manage it, yet annually over 175,000 Americans die from hypertension-related issues, despite following prescriptions faithfully. I'm Dr. Michael Kent, and after more than 20 years performing cardiac surgery, I can explain why drugs frequently fail to fully control this condition. Most are told hypertension is a plumbing problem. Too much fluid in the arteries. Reduce salt, use a diuretic, monitor numbers. But that explanation is outdated, incomplete, and leaves millions at risk. The true issue is not fluid, it is arterial damage and rigidity at the cellular level. Healthy arteries are elastic, recoiling with blood flow. Long-term high blood pressure destroys that elasticity. Medications adjust numbers but cannot repair damaged arteries. By the end of this presentation, you will understand the 4 hidden processes causing hypertension and the 4-step method that can naturally repair arteries at the structural level. Before continuing, leave a comment with your age and how long you have had high blood pressure. The first hidden process is glycocalyx destruction and endothelial injury. Imagine arteries as smooth, non-stick channels. The endothelium is a single cell layer lining every artery, shielded by the glycocalyx, a microscopic protective film like Teflon. This layer ensures smooth blood flow, prevents inflammation, and produces nitric oxide to keep vessels open. When damaged by high blood sugar, chronic inflammation, smoking, and oxidative stress, the glycocalyx erodes. Once compromised, arteries stiffen, plaque develops, and nitric oxide decreases, raising blood pressure. Hypertension medications do not restore this coating, which is why many feel at risk despite controlled readings. The second hidden process is arterial rigidity and calcification. Doctors often focus on numbers but ignore flexibility. Arteries should stretch and recoil with each heartbeat. Long-term pressure, diabetes, and inflammation harm the tunica media, the middle layer providing elasticity. Calcium accumulates, elastic fibers break, and smooth muscle cells turn bone-like, promoting hardening. Pulse pressure, systolic minus diastolic, indicates this. Normal is 40-50 microscopic, over 65 suggests rigid arteries. Pulse wave velocity measures stiffness. Healthy arteries conduct at 6 to 7 meters per second. Rigid ones at 12 to 15 meters per second. No drug removes calcium or restores flexibility, but targeted nutrition and lifestyle can partially reverse it. The third hidden process is nitric oxide shortage. Nitric oxide, produced by endothelial cells via eNOS, relaxes vessels. Glycocalyx damage impairs eNOS. Uncoupled eNOS generates free radicals instead of nitric oxide. Without sufficient nitric oxide, vessels stay tight, resistance rises, and pressure increases. Isometric hand grip exercises, 30% max strength, 2-minute hold, 1-minute rest, 4 repetitions, 4 times weekly, stimulate eNOS and lower systolic pressure, 8 on 12 points. Nasal breathing raises nitric oxide up to 400%. The fourth hidden process is the insulin-kidney link. Elevated insulin prevents kidney sodium excretion, raising pressure. This occurs in insulin resistance without diabetes. Time-restricted eating, 16.8 fasting, and resistance training improve insulin sensitivity, freeing kidneys to excrete sodium normally. Examples show these processes clearly. John 71 had hypertension 13 years on 2 medications. Readings averaged 130/82, but tests showed endothelial dysfunction. After blood sugar stabilization, 800 mg fucoidan daily, and polyphenol-rich foods, berries, greens, pressure fell to 116/74 in 12 weeks. Endothelial function improved, and medication reduction occurred after 6 months. Martha 74 had hypertension 18 years, 4 medications, severe calcification on CT. With vitamin K2, MK7, 360, mcg, vitamin D 6,000 mg IU, magnesium glycinate 600 mg daily, calcium score dropped 9% in 6 months, pressure reached 122/78, and medications reduced to 3. After 18 months, calcium score improved 16%, and she maintained control on 1 medication. The 4-step vascular protocol targets these processes. Glycocalyx restoration, blood sugar under 140 mg DL post-meal, fucoidan 600 1000 mg daily, polyphenol foods, decalcification, vitamin K2, MK7, 180 360 mcg, vitamin D 6000 IU, magnesium 400 600 mg, nitric oxide restoration, folate, vitamin C, vitamin E for BH4 protection, hand grip exercises, nasal breathing, insulin reset, 16.8 eating window, resistance training. Expectations. Week 1 brings subtle changes, less stiffness, slight pressure drop, energy increase. Week 2 shows noticeable systolic reduction and mood, energy improvement. Weeks 3-4 deliver vascular function gains, nitric oxide rise, early calcification reversal. Beyond week 4, structural changes appear, reduced rigidity, lower risk, possible medication reduction under supervision. Consult your doctor before changes. Those with kidney, heart, or diabetes issues need supervision. Start 1 step at a time, monitor pressure daily. Challenge. Choose 1 vascular element, commit 30 days, track results, share in comments. Your arteries have supported you for decades. Give them proper care. Hypertension is not permanent. Addressing cellular causes can reverse it. Medications manage symptoms. Root correction normalizes pressure naturally. Take steps to prevent events and improve vascular health. Choose reversal over management. I'm Dr. Michael Kent, and I'll see you in the next video.